A lot of services right now are provided in hospital, and we feel a lot of services that are provided in hospital aren't necessarily best suited for hospital. They can be provided in the community. It identifies a niche or a need in the community that we thought was there, and it certainly has been, come to fruition that yes, the needs were there and we are meeting those needs. Our objective here is to provide the best quality of life for people of all ages.
We found Kensington Gardens when my mother had been moved into a retirement home by my sisters and I, and the retirement home just couldn't deal with my mother's behaviors. She had Alzheimer's, beginning stages of Alzheimer's at that point, and so things got very progressively worse, and so we called Community Care and Access and ran around for about 3 weeks looking for a suitable place and fell in love with Kensington Gardens. Absolutely fell in love. The way it was set up, the colors, it was just, it felt like home.
The waiting list for screening has been very long in most hospitals over the last few years. This clinic has been designed with the colonoscopy procedures in mind, and because of that, it's a very efficient and effective patient flow. We are able to screen the patients very rapidly within a week or two, as opposed to waiting. In many circumstances, patients had to wait as long as a year.
We make it an easy operation for patients having cataract surgery. I don't mean the procedure is easy, we make it, we actually make it easier for the patient. In the past, say 5-10 years, there was a long waiting list for cataract surgery. Now that Kensington is open, we have basically taken away the waiting list.
Staff at Kensington have been phenomenal. Absolutely caring, compassionate, able to laugh, able to joke.
We represent each other, so what we do at the Eyes Institute represents what they do at the Screening Institute, and that represents what they do at the nursing home. So we have a responsibility to achieve that standard of care.
We are particularly thankful to the foundation, without which Kensington Screening Clinic could not have been built or existing. So without the support of the foundation, none of this could have happened.
In the palliative care time, yes, Mom was incredibly well looked after. They met our needs, allowed us to be with Mom, allowed us to direct what the care would be, how the care would be. Spent a lot of time guiding us through the process, identifying what the stages would be. You just felt that sense of family.
Our last project that we're working on in conjunction with the Princess Margaret Hospital is Kensington Hospice, which will be a 10-bed residential hospice.
I think that the hospice is going to be absolutely wonderful. The ability to be able to spend time in a quiet atmosphere that is reflective, that is attuned to the needs of the individual people in the hospice.
So who benefits from Kensington Health? It's our residents, it's the families we're involved with, it's the community, it's our stakeholders, and it's the overall health system in Ontario. That's who really benefits from what we deliver at Kensington.